I'm pretty used to being woken up every 3 hours now in the middle of the night at this point. It's like 7:30 in the morning, and I've been woken up 3 times to get vitals, to get my weight, to get blood drawn, to write out my sentence and do my sobriety test and get eye drops and all this kind of stuff. So sleeping during the night is kind of really difficult, and I'm expecting the doctors to come in here any minute now, or like at least within the next hour, and wake me up anyway. So I almost feel like there's no point in even trying to go back to sleep. From what I'm seeing on the board though, from them taking my blood and everything, my white cell count is finally almost down to normal. The highest point of normal is like 12, which is short for 12,000. Looking at my board, Friday it was at 64.6, again, thousand, and yesterday it was 15.4, so things are looking good. Today's supposed to be my last day of getting chemo, at least until we figure out whether or not we need more chemo. At least as far as the way the plan is right now. The plan was to give me do a little bit of chemo, see where we're at with it, see how my body's handling it, see if it's taking out the cancer cells like it's supposed to, and then based on that, we either find a different alternative route or we progress with chemo, or I don't know. We're basically just playing it by ear. But phase 1 of treatment seems to be going okay so far. I haven't been feeling sick. I've just been peeing a lot still. My hair's not coming out. I'm not getting any mouth sores. I don't really feel any different. So, I mean, my body's handling it pretty well, a lot better than I honestly thought it would. But before they give me chemo every day, they give me like a whole big thing full of medication too, like right before. Like in the morning, I take like a fistful of pills, and then I take like 4 or 5 pills that they give me before, like right before I start chemo for the day. So I think that's helping with a lot of it, at least. So I'm going to try to get up and like do laundry today, because I've gone through my first week of clothes, which is all I brought was a week. And then when the doctors come in, I'll try to get that recording, just like I have been lately, just the audio of us talking. But so far, so good. Just kind of just getting used to the whole process of everything now, as annoying as it is to be woken up constantly. Mandy's supposed to come over tonight after work, so very, very much looking forward to that. So it's gonna be a good day today. I woke up, first thing I wanted to do was play Fallout. So I'm gonna play Fallout, walk around all day until she comes, and try to pass the time as best I can. So that's the plan. I'd be lying if I said that this wasn't super annoying. This is my phone charger coming from back behind here. My cord coming all the way back through here. It's a 10-foot cable, and I had it set up to where I could just have it, right up here on my bed with me. But I noticed that it doesn't move very well, because somehow, from when they were changing my bedding and not paying any attention to my cords or anything like that, somehow the cord got caught in the gears of my bed, and as much as I try to adjust it, I can't get it out, and that's kind of really goddamn annoying. So I don't know if I have to call somebody to try to get that fixed, but it is stuck in there, and it's not getting out just from me. So I'm kind of really annoyed right now. Mm-hmm.
Good morning.
Morning.
How are you?
I'm good.
Good. Anything new today?
Nothing I've noticed so far.
Okay. Your platelets are low.
Mm-hmm.
So we'll give you a unit of platelets today.
Okay.
I'm noticing the bruise here. Are you having any bleeding anywhere?
A little, not like a ton. Like I had a little scab that came open here that was bleeding a little bit today. Is about it, but no like abnormal bleeding or anything.
Okay. Okay. Your white count's coming down nicely. It's down to 6,000.
Oh, okay. I was looking at the chart on there too, and I saw that it was coming down pretty quickly.
Yeah, and that's what we expect.
Mm-hmm.
That is no indication of, it's not good, it's not bad, it's just is.
Okay.
Obviously, if the white count's going up, that's concerning, but.
All right.
Everybody's white count comes down very nicely. It doesn't predict, the rate at which it comes down does not predict your
Sure.
responses, so
Hmm.
I wouldn't interpret it except that everything is.
Yeah, it's just kind of doing what it's
Yeah,
intending to
doing
do,
what it's
basically.
supposed
Okay.
Um, so your kidneys are doing very well with that.
Good.
So we're gonna cut down even further on your IV fluids today.
Okay.
I suspect that by tomorrow, Tuesday, we will just stop the IV fluids.
Okay, and basically just do like the chemo probably.
Yeah, take the chemo and sort of fluids with the chemo, and then you just, you know, drink.
Right.
Okay.
Okay.
That's pretty much it from our perspective.
Okay.
Anything from your perspective that you
Not really, no.
or have questions about?
No, I'm just kind of just hanging out, waiting everything out and
Okay.
all that. So yeah, nothing really alarming or different or abnormal. Like I haven't really experienced any side effects of the chemo other than like my stomach hurting slightly, but not nauseous or anything. Just like how it was when I had it before. I haven't noticed any mouth sores, my fatigue or tiredness or anything. I haven't experienced anything with that. No hair is falling out, or at least not any faster than normal.
Okay.
So,
Okay.
but yeah, no, I'm actually really surprised that like normally around this time when I had it before, at about the 5-day mark, I would start feeling like I was getting a really, really bad fever, and I'd still feel perfectly fine. So,
Well, that's gonna happen at one point.
well, yeah, no, I know that's unavoidable, but
Yeah.
I'm pretty surprised it hasn't happened yet. But I think like the meds that they've been giving me beforehand probably help, because I don't remember taking those last time I had chemo.
Yeah.
Mm-hmm.
Okay. Yeah, we'll just keep monitoring.
Okay,
Okay.
sure.
All right.
And then after chemo today, because today will be my last scheduled one at least, and then we go on to the bone marrow biopsy after that, correct?
Yes, 2 weeks from when you started.
From when we started the chemo?
Uh-huh.
Okay, so that was Thursday, was it?
I believe it was
Today's day
Wednesday.
5.
Yeah.
Wednesday would have been, yeah.
So in 9 days.
Okay,
Okay.
all right, sounds good.
right.
Trying to mentally
Yeah, no,
prepare for that,
okay.
because those
Yeah.
are awful. Maybe my
We can give
fifth
you
one,
some
I think.
medicines to try to help you go through it a little bit more peacefully.
Okay. I mean, the last one that I got was fine, but then it was on. So I've had when the one they gave me Monday, that was my fourth one. And that was the first one they did on the opposite side. All the 3 previous ones were all on the other side. They just got worse and worse and worse. So, yeah. But the last one was good. It was just pressure, not a lot of pain, but
Okay, and that's the way it's supposed to be.
yeah, right.
Yeah.
Still not pleasant, but
No.
better than 2 and 3.
Yeah.
So.
Okay, good. I'm glad it went a little bit more peacefully.
Mm.
Maybe the next one will be even better.
Well, we'll see, hopefully.
Yeah.
Thank you guys very much. Hmm.
So for anybody curious, is what I was referring to earlier, as far as like my white cell counts and my blood platelets and hemoglobin and all that. Don't ask me what hemoglobin is, because I don't remember. I've had it explained to me 100 times, but I don't remember. My platelets, which are obviously marked in P, and hemoglobin in H, my platelets are what causes my blood to clot and to basically stop bleeding forever. So those are pretty low. I don't know what the normal amount is for stuff like that. So I don't know, anybody watching these videos that knows anything about that sort of thing, maybe they can comment. The W is my white cell count, and it's finally down below normal. Not below normal, but at normal. So 64.6, which basically means 64,600. Extremely high. They were able to get it down to 15.4 thousand, which is much better. 12 is about the maximum that's considered normal. Typically about 4 to 12 is a normal range. And we are down to 6. So we're at what I feel like is the optimal range. And from what the doctor was saying earlier, if anybody listened to that, doesn't necessarily mean that I'm out of the woods. It just means that things are going how they need to go. But there's not really a clear indicator on whether or not this is going to be, how soon I'm going to be through this, basically. So
yeah, but things are looking good though for everybody's watching, and keep everybody updated as things change. Right now, I'm getting my that little applesauce bag there that looks like they're pumping into me. That is my my blood transfusion. Well, not blood, but like my platelets and things that are in blood that's supposed to help my blood get better. So that's being pumped into me right now. It's the second one of those that I've had. It does look like applesauce a lot, though, doesn't it? It kind of makes me want some. So maybe spoke a little bit too soon about the whole not getting sick or feeling like crap or anything. Just got up to go do my laundry. Went on the exercise bike for a little bit, just kind of walked around for a while. And yeah, I'm definitely noticing I'm getting short of breath, a lot easier, kind of lightheaded when I get up and move around. And I mean, it's not like I was walking at like a rigorous pace or anything. It's just kind of walking just at a slow, normal pace. The exercise bike, really, I just sat on it and basically just pedaled while I was dicking around on my phone the whole time. So I didn't really do a lot there either. Like, I definitely haven't done anything to overexert myself yet or anything. But yeah, it's starting to catch up really bad. Like, I don't feel ill, but it's like when I get up and move around, that's when I just, no cardio whatsoever. So I don't know. I'm going to keep an eye on that. I'm kind of really glad this phone has like pretty good light settings, because otherwise I don't think you'd be able to see me with this window behind me. But yeah, I'm like in downtown Indy. I've got a pretty decent view, but I don't know, there's not really much point to this particular part. I'm just kind of sitting thinking about how bad this sucks, because like the whole thing, like I got lymphoma, like this particular leukemia I got from my lymphoma being treated. And I ended up getting lymphoma because I was HIV positive when I found out. And I found out that's what actually caused it. And I had it for 5 years. I had no idea. Had I known before, probably wouldn't even be in this mess. But then it goes back to, well, how did I get that in the first place? Well, I got it from being stupid. So as bad as this sucks, and like just being stuck here, not just being stuck here in the hospital board, but having all the momentum that I had wrestling in 2017 going into 2018 with the death matches and everything. And then losing wrestling almost altogether because of the stigma with HIV. And then just being bored here in the hospital all the time, not being able to work for, like 6 or 7 months, I think it was in 2018, not being able to work for like a month or longer at the start of this year. Just, it's all because I was an idiot one day. Just one time I did something really stupid, and this is where I'm at with it. So it sucks really bad, and I hate sitting here thinking about it, but I don't have anything else to do but to sit and think about it. So I don't know, I guess this is just me venting. I guess I don't really have anything to really talk about or discuss or anything. It just sucks really bad. So right now we are looking at chemo number 9 of 10, which means that thankfully I only have to do one more tonight. Like this usually runs for about half hour to an hour. They usually give me another one at night around 9 o'clock, and that usually goes for about 4 hours. So at that point, I will be, at least for the time being, completely done with chemo and gotten all 10 rounds knocked out, which I am pretty excited to be done with. And then after that, we just kind of move on to the next step. I think I touched on it a little bit earlier, but yeah, so week 1 coming to a close officially today. And that puts me about 1/4 of the way through getting this treated. So at least for being here in the hospital, getting it treated. I don't know if I have to come back for a stem cell transplant or if they're just going to keep me here and do it. I'm not really sure exactly. We're just kind of playing it by ear and seeing where we're at. So things are looking good, though. I'm still feeling pretty good despite having all this chemo, rammed into my butt here. Technically, it's being rammed into my arm, not into my butt. But yeah, so we'll see where we're at from there. Probably going to have an easy couple days, but usually it's around the 5-day mark when I would start to get sick. So I'm fully still anticipating this catching up to me pretty quick. So, but yeah, we're getting there little by little. So yeah, it's like 2:30 in the morning now. Mandy came over. She's been here for a few hours. It's been amazing. Hands down, best night, best day that I've had here. Just having her here, it's amazing. Like, couldn't have asked her for a better day so far. And she's probably gonna watch this tomorrow and then be like, "Oh," because you know. Also, fun fact: for the time being, at least, I am now officially done with chemo. So now we'll see where we go from here.